Povidone Iodine Hand Wash is often used as an antiseptic agent for surgical hand scrubbing. It's generally used in situations where there are no contraindications to its use and where it is considered appropriate based on the patient's medical history, the type of surgery being performed, and the preferences of the healthcare facility. The buying links to Povidone Iodine Hand Scrub are provided in the description of this video. If you like such informative videos to keep you updated, please subscribe to this channel so that you do not miss our latest updates. Here are some scenarios when Povidone Iodine Hand Wash might be used for scrubbing into surgery. Standard surgical scrub. Povidone Iodine Hand Wash can be used as part of the standard surgical scrub protocol for healthcare personnel involved in surgical procedures. It helps reduce the microbial load on the hands and forearms before donning sterile gloves and entering the sterile field. Alternative to Chlorhexidine. In cases where there might be contraindications or allergies to other antiseptic agents like Chlorhexidine, Povidone iodine could be used as an alternative. However, this decision should be made based on the individual's medical history and any known sensitivities. Patient allergies. If a patient has an allergy to Chlorhexidine or other antiseptic agents, Povidone iodine might be chosen as the preferred option for surgical hand scrubbing to prevent any potential adverse reactions. Preference and protocols. Some healthcare facilities may have established protocols or guidelines that recommend or require the use of Povidone iodine for surgical hand scrubbing. This could be based on local infection control practices and preferences. Specific surgical procedures. Certain surgical procedures might require the use of Povidone iodine due to its broader spectrum of antimicrobial activity, especially against viruses. This could be particularly relevant for surgeries where there's a higher risk of viral contamination. It's important to note that the choice of antiseptic agent for surgical hand scrubbing should be based on careful consideration of factors such as patient safety, surgical type, allergies, and institutional protocols. Always follow the guidelines and recommendations of your healthcare institution and infection control experts when deciding whether to use Povidone iodine or any other antiseptic for surgical scrubbing.